How have things been since the last time we met?
Oh, pretty good, I guess. Doing all right.
Okay. You want to give me an update on how you've been working on things?
Um, well, just been doing the same old thing that we talked about before. Uh, just trying to control, just trying to keep control, keep cool, think things out a little bit, try to plan it out a little bit in my head and work through it before I react. Um, been trying some of that. Been working pretty good. I haven't really lost my cool lately. Uh, so I think it's been good.
Okay. So today we're going to create you a treatment plan. Basically map out the problems that you're having and your concerns. We're going to set some goals and objectives and create a treatment plan.
Okay.
Okay, so I'm just going to ask you some questions and you just answer them as honestly as you can.
All right.
So what would be your presenting problem?
My presenting problem? What does that mean?
It means, what is the problem that we're going to create this treatment plan about? What are we going to treat?
Anger. Anger outburst, I guess we'd say. Outburst of anger.
Okay. So what are your main concerns with your anger?
My family, my friends, just breeding a miserable environment for them to be around me. They have to like walk on eggshells around me to try to not get me upset because they know I can very easily, and it's just a miserable time, I guess I'd say. Miserable to be around me, and I don't want my family to be miserable all the time. So. So I think that's about number one. That's about the best thing there is. And the same thing happens at work with friends and co-workers and just anybody in general. I think that's the main problem.
Okay, so what specifically do you want to work on?
I don't know. Well, guess what we've been working on? I don't know. I guess just my anger. Just trying to learn how to control it, because I can't stop it from coming. I know that the anger is going to come, but how to control it so that I don't vent out and just let it show. To be able to be like normal people and just, if something happens that bothers them, to not let their emotions take complete control.
Okay. Let's see here. So you're saying that you have anger. Now, if you could diagnose yourself with something, what do you think your diagnosis would be?
I think it probably sounds like a couple things. Sounds like bipolar. 1 minute I'm fine, then 1 minute I'm not, then 1 minute I'm fine, and back and forth all day long for no reason whatsoever. Sometimes too, nothing even happens and I just feel that way. So I think something like that, if that's what it is, bipolar. And then maybe depression. I don't know. I guess it'd be something like that.
Okay. So when you're forming a treatment plan, we have to set up some goals and then objectives to reach those goals. So what would be your number one goal? What's your number one outcome that you want through this whole process?
Just control my anger. Just be able to, I guess, not just control it, just not to get angry. That would be the best thing. Not to get angry anymore for no reason. Figure out what's causing that. I could see if something causes me to get angry and then I lose control, but just to get angry for no reason and just feel angry about something, and then any little thing gets under my skin because I'm already angry. So it'd be to try to figure out what's causing that.
Okay, so if that's your number one goal, what is something that you can do that will help you reach that goal?
Well, like I said, meeting with you. Last time we talked, just meeting with you is the first step, I think. And talking about it has helped. But I don't know if it's a long-term thing that can help. I don't know. I guess that's the first thing I'd have to do. Then I had talked about meeting with someone that can maybe give me some type of maybe medication if that's what I need to help me not be so short-tempered and angry all the time. That's it, I guess.
Okay, have you ever considered maybe role playing or just having a mock conversation with a friend or family member and practicing controlling your temper when things make you angry?
No, I've never thought about doing something like that. Never done anything like that.
Do you think that it would help you?
I don't know. To tell you the truth, I don't know if something like that help or not. Probably, I guess, if you're going to act it out, and then it just help you to understand. So when you're really in it, it's like anything. If you just practice, then maybe when the time comes, you'll be prepared, more prepared, I guess. So I don't know.
Okay. So in order to reach your goal, we have to set some objectives. Would you like that to be one of your objectives, is to increase your ability to listen while others speak and then role play situations? You can either write them down in a notebook and identify the issues, or you can actually practice them with a friend or a family member.
Yeah, I think that's something I can do. Give it a shot. See if it helps.
Okay. Now, how are your relationships with your family?
With my family?
Mhm.
Well, fine, I suppose. I just because of this, I mean, this causes trouble, causes problems, causes fights between my wife and I, arguments, because I am the way I am, constantly snapping at her. Or, like I said, just hard to be around me because you never know what's going to make me mad or what kind of mood I'm in and all that stuff. So just the environment is just kind of a miserable environment and to be around. But I think other than that, we have a good relationship. And it's the same with the kids. Same thing, they're just don't want to be around really, I guess. Just want to stay in their rooms away from me. And I don't know, it just seems like the whole house is kind of out of whack because of it. Just something needs to be done. Mm-hmm.
So how would you describe your communication with your family?
Not good. I'd say not good. We don't really communicate. Everyone just kind of does their own thing, and there ain't a lot of talking going on. I go to work, I come home, watch TV, go to bed. That's about it. I mean, ain't a lot of talking going on. And I know it's because of that.
So do you think if you expressed what was going on with you and your anger and things like that with your family, what effect do you think that would have on your communication and your relationships?
Well, none really, because I've done that. We've talked about it, and and I've apologized for it a million times, and we've talked about it, and I just do it again. So they understand. They know I am the way I am, and they know I'm trying to get help. That Dad has a problem, and he's trying to figure it out, and they understand all that. But it still doesn't fix that communication, because the problem's still there. And I think that if I get a grip on it, then it would change things, but it hasn't right now.
Okay. So, you keep saying getting a grip on your anger. What anger management techniques have you tried?
Just what we talked about, just kind of trying to take a deep breath and remove myself from the situation before I respond, and think about the different responses that I can have, and then trying to respond, like at work or with my wife. I've tried that, and it's worked for a period of time. At times it didn't. It was just too much, but it helps some, but I don't know. It'd be hard to do that forever, but it's helped.
So, you keep saying how you respond. What is your typical response when something does make you angry?
My typical response when I get angry is to yell. I guess if that's what you're asking, just yell. And scream, and I don't know, just get hot. Just hot comes over me, and I feel upset and just overly angry, and I just yell and take control of the situation.
So do you think it would help you to, express your anger in new ways instead of, yelling or using a loud voice? Maybe learn some new ways to communicate when you're angry?
Yeah, I just don't know any new ways. That's the whole thing. I wish I could respond differently in that way. I guess you mean like talking it out or something like that, but yeah, probably would help.
Okay, so as we're making this treatment plan, do you think that could be one of your objectives, is to try different things once you become angry? You can express your anger through exercise, talking it out, writing in a journal. You want to try some of those things and maybe critique them and see which one?
Yeah.
Okay. What do you think would work best for you?
Oh, I don't know. Probably journaling it. I'm just so busy with work. I don't have time to go to gym and do stuff like that. But if I had to do one, I guess be keep a journal. But I don't see how that will help. I don't know how writing it down after it happens is gonna help. I guess it does. People say to do that, but I don't know. I know they say the gym helps to release some anger and stuff and stuff like that. It's hard to find the time to do that.
Is there something that you really enjoy doing?
Yeah, I enjoy going fishing, hunting, stuff like that.
So would you say when you're doing things you enjoy, it is easier or harder to anger you? Or the same?
I say it's harder. It's harder to anger me while I'm fishing. I don't know, it's hard to say. I guess if the kids are there and throwing rocks in the water and being loud and all that, I can get angry. But I guess I'd have to think it's harder to get me angry in that situation.
So do you think changing your mood would change your actions?
Changing my mood would change my actions. Yeah. Yeah, because that's the whole point of it. My mood is in a bad mood, which causes me to just have an outburst of anger at the littlest thing. So that's the whole source of it, my mood. How do I change my mood? Which just happens to be for no reason whatsoever. Just like today, just in a bad mood. I just don't feel like doing anything or talking or dealing with anybody or anything like that. So yeah.
What are some things that change your mood now? When you find yourself in one of those moods, is there anything that can help you change it?
No. Nothing that I can think of. I've tried and I've tried and I've tried, and it's just there. I can't explain it. It's just there, and it's just going to be there till it decides that it's gone. Just the way it is.
Mm-hmm. Do you think that reflecting on positive experiences you've had, once you become in a bad mood, if you start to think about the good things you've done that week or positive experiences, that will help you keep a positive outlook and a better mood?
Yeah, but the thing is, you get angry and then you just don't care. And so to try to have an out of body experience and to try to separate yourself from that mood and think of good things is hard to do. It's easier said than done. How do you do that? You just push your mood aside and then start thinking happy thoughts and about a good time in history that you enjoyed. That's hard to do. I imagine it can help if you could think of something like that. And maybe that's what happens when you're in a bad mood, then all of a sudden you're in a good mood. Maybe something came on TV or a song or something like that you heard that changes your mood.
Okay. So, who would you say is responsible for your moods? Do you think that you're responsible for them, or do you think it's somebody else is responsible for them, or do you think nobody is responsible for them?
I think that I'm responsible, but I think there's something going on in me that causes it to happen that I can't control. Like I was saying, bipolar or something there, that it's some type of chemical imbalance that just is in me. Because depression runs in my family, and bipolar, and my dad was this way, and it just seems to be something that's there that I've always had and dealt with, and no matter how much I don't want it there or I try, it just keeps coming, and there's just nothing just seems to work. Whatever I do and talk to people and try to control my thoughts and try all this stuff, and it's just going to keep on coming. It's just going to keep being there. Mm-hmm.
What are some things that you think could keep you motivated and keep you trying and stop you from giving up?
Well, my family's my motivation. I can't never give up. I've got to do something. I've got to try. I mean, I just can't just give up on it, you know. But I guess that'd be my main motivation, if that's what you mean.
Okay. So do you think that just reminding yourself when you have a small success or you found that you didn't get angry over something you would normally get angry over, do you think that just having positive self-talk or journaling or sharing that with somebody could help you stay motivated?
Yeah, I think it's gonna have to have some accountability to someone or some people, and just uh, being able to just, if they see it happening in my family, maybe my wife pointing it out, but then that just makes me more angry. But yeah, I think staying on top of it and working towards it is going to help some. It's already helped some. So some is better than none right now. So yeah, I think all that stuff can help.
Okay. And let's talk about your physical health because physical health can affect your mental health. How would you say your physical health is?
I guess not so well, compared to what the doctors think it should be. I don't know. I'm overweight, high blood pressure, and high cholesterol and stuff. I don't know. I not in the shape I used to be in. I get kind of tired easily and stuff like that. But I don't know. Health wise, I don't have any problems, no sicknesses or anything like that as far as that goes. But the high blood pressure, along with the anger, doesn't help. Isn't a good mix. I know that. So I don't know. I guess average. My health is compared to average of people my age. I don't know.
So, would you agree that your mental health and your physical health are sort of intertwined or connected?
Yeah, I guess so.
Okay, so would you say that your mental health is more affecting your physical health or your physical health is more affecting your mental health?
Mental health probably affects your physical health more, because stress can cause a lot of things to your body. I never heard of your body hurting you mentally, so I'd say mentally hurts you physically.
Okay. So let's cover some of your strengths here. What would you say are some of your strengths?
As far as what?
Just your personally, what are some of your strengths in life? What are you good at?
Well, I think I'm good at my job. Always try to do my best at my job and whatever I do. I think when I'm into construction and carpentry and stuff like that, and every time I go to work, I try to do my best, and I think I'm pretty good at that. Dependable. Always go to work when I have to every day. On time, never late. So I think that's probably one of my strengths there.
Okay. Anything else?
I don't know. No, I think that's probably all I could think of right now.
Okay, so we did talk about exploring anger management techniques and We talked about some journaling and sharing your positive experiences with a friend, role playing some experiences with your wife or a close friend or family member. Now, what would you say might be a barrier to you accomplishing those goals? What's something other than your mental issue that you're having, the anger and the mood problems? What's something in your life that might get in your way?
My job, I work 65, 70 hours a week. So it's hard to do anything. I get home, leave early, get home late. Basically got to eat, get a shower, go to bed, get ready for work next day. So I'd say work gets in the way a lot. Being able to journal and role play and all this stuff, that'd be kind of hard to do.
So, what is something you can do to maybe control your work schedule or to make more time for you to work on your mental health?
Ain't really much I can do. I mean, I'm needed there every day on the site. I mean, ain't much I can do. I probably on the weekend or something when I'm off. I usually don't work Saturdays or Sundays, so probably have to do it then because during the week there's no way. I just can't get off. I just got to. I'm needed, and I've got to be there. So probably weekends is when I'd have to do it.
So, we know that support plays a major role in bettering yourself. So, on the weekends when you're working on these things, is there two people that can help support you and offer help to you? Can you identify two people in your life?
Well, my wife, for one, should be the number one person. That would probably help. And then I guess it'd be probably my friend that I work with, my co-worker that's with me just about every day. He knows me. We've known each other since we were little, so he'd probably help me, I think, if I explained it to him.
Okay. So, let's see here. Do you take any medications now, whether for physical issues or mental issues? Do you take medications?
Physical, yeah. I take it for my blood pressure, and my high cholesterol. I take it, and I take some fish oil, and that's it.
Okay, and do you take those medications according to the directions as often as you're supposed to?
Mm-hmm. Yep, just like it tells me to every night before bed.
Okay, and how would you say you are on blaming? Would you say that you blame anybody for anything or any of your actions?
Yeah, I blame everybody. No matter what situation is, it's everyone else's fault. Whoever's there, whatever problem is, I blame everyone. And usually my wife is the main recipient of that. It's all your fault. I feel the way I do and saying what I'm saying and look what you did and, that type of stuff.
So do you think by blaming, do you think that possibly you're allowing yourself to make an excuse for your behavior because then it wouldn't be your fault?
Yeah.
Is that what you think is going on?
Yep. That's exactly what I'm doing. And I know it. Oh, excuse me. I know it not until it's already said and done. then later on I think about it and I know that's what I did, but in the heat of it, I honestly believe it's their fault. And then later on I just realized I was in a bad mood and I got angry again and blew the situation up bigger than it really was, and now that person's miserable and upset too, and every time I'm upset I gotta make everyone else upset around me, and so yeah, blame people.
Okay. Do you think that there's something, once you realize that you blamed somebody for your own actions, what do you do from that point? Do you admit it to them or do you keep it to yourself?
I keep it to myself. Don't usually go and apologize and rehash the event and all that stuff. It just set me off again and all that stuff. So usually keep it to myself and don't say anything to them and apologize or anything like that.
Now, when controlling your anger, we talked about practicing some anger management techniques and seeing which one best suits you. Do you have any in mind that you would like to try?
Not really. I mean, I don't know many techniques. I mean, like we said, the journal. You mean like journaling?
Journaling.
I could try that.
Artwork. Some people even do yard work. Going to the gym. Just something that can express yourself without expressing anger and also put you in a good mood.
Yeah. Well, I already do that. I think I go to work and try to just set my mind on what I'm doing, to just kind of not think about things that might get me upset, and just kind of put myself fully into that. So, I mean, I don't know. If I go to gym on the weekends, that's kind of when I try to relax and just kind of rest, but maybe it's something I'll think about.
Okay. And other than your anger management issues, are there any other poor, they're not strengths, but your weaknesses? What, do you have any of those other than your anger?
I don't think so. Nothing I can think of. I mean, I'm sure I do, but I guess just, like it all stems through that, I guess, just not expressing myself and talking with people, and yeah, I guess that's it. I don't know. I mean, other than that, that's my main issue. I mean, really my only issue is just that anger.
Okay. Now, if I were to refer you to maybe a gym or physical therapy to help you express your anger, do you think that's something you'd be interested in doing or maybe have time for?
Interested in doing it if it's going to help with time. Wise, I don't know if I'll have the time. I guess I'd try to make the time, but I mean, I'll give it a shot, see what happens, see if I can make the time, if I could do it and keep the appointments, and best that I can. I've got to do whatever I got to do to try to help this. So yeah, I guess I'd give it a shot.
So, is there anything else that you would like to cover in this session today?
Just, I need to talk to somebody who can maybe see about medicine. Like I said before, I think that's the main problem, that I don't know what that stuff does, but something that makes you happy and helps you to control your emotions. I don't know what people, someone can actually tell me, is it bipolar, is it depression that I've got? If so, then how do you treat that? What are, something like that, I mean, that can aid me in trying to do these things we're talking about. Something to give me because I do it all day long, but I can't do this for the rest of my life. Just try to do techniques and talk and all that stuff is just going to need something to help me.
Okay, that's actually where I was headed next. I have a friend, it's Dr. Anis Ahmed. He's in Millsboro, Delaware. He's a psychiatrist, and I believe that he can help you identify those issues and possibly get you set up on any type of medications you may need. And I'm actually going to call him and I'll schedule you an appointment and give you his information before you leave here today, and we'll see if that's something that can help you.
Okay, good.
Okay, and I also do recommend you find maybe a gym or somewhere you can go to get away and express yourself, and maybe make some time for that this week, keeping in mind your objectives and your goals. And we'll evaluate how your appointment went with Dr. Ahmed next week, how you kept your goals and your evaluations, and just have an update. We're going to follow up next week.
Okay.
Alright.
Alright.
Well, thank you for your time today.
Thank you.
Yep, and I'll see you next week.
Alright.